helping make your life easier. Moms Every Day.
Hi, welcome to Moms Every Day. I'm Hattie Cheek. Dr. Steve Wilcox with us again from Cabell Huntington Hospital. And we're talking about one of the most annoying plants that there ever was, poison ivy.
For sure. Yeah, it's a real problem in this region.
And you know, so what are we looking out for? How can we combat the poison ivy season?
Well, avoidance is really the key here. My biggest advice, I think, would be to learn what the plant or plants, or we have several different species that affect us here. Learn what they look like. Do whatever you can to eradicate them from your property, and just avoid is the big key.
And I have to imagine a lot of people are affected by this year. But about how many people are affected by poison ivy every single season?
Well, it's a great question, and the answer is it's a very large number. About 75% of people are allergic to the resin that's in the plant, and every year the people that seek treatment is somewhere between 25 and 40 million people.
Hospital treatment?
Well, physician treatment,
wow.
Healthcare provider treatment. And you got to know there's a bunch of people that don't seek treatment, so it's probably somewhere around 20% of the population in the United States is affected every year. So it can cause some serious problems then? It can. For most people it's a major annoyance, the itchy rash and that type of thing, and it's very uncomfortable and interferes with sleep. There's some very rare cases where the rash will actually become infected. Anything that disrupts the normal protective barrier of the skin allows germs the opportunity to get in and do their thing. And there's some very rare side effects that affect the kidneys, but those are almost unheard of. Almost unheard of. And I mean, I guess it has to get to a point where you haven't gotten to the doctor is when you have those serious issues, typically? Typically, yes. Now, how do you treat it? Well, there's a bunch of things that you can find at the store, but the only things that have been proven to be of any benefit are two things. One, a super potent topical steroid, ointment or cream, but those have some limitations in terms of what body parts you can use them on. Really, the only way to effectively treat is with oral steroids. Oral steroids. Yeah. And is that for the rigorous poison ivy, I guess? Because I've had it before, and I've just used calamine lotion, and I think it worked. I mean, it eventually went away. I don't know if the itch was ever totally gone until it was gone. Well, ultimately, it depends on the degree of exposure that you have and the degree of reaction that you make. And if you just have a little dime-sized spot on your arm, you're going to get by fine using the topical, the calamines and Avenos and those types of things. But if you have more widespread involvement, and if it's on the face, just the swelling really can be an issue. Face. Yeah, you really need those oral steroids to settle down the immune response. I couldn't even imagine, but I bet you it's so easy to do because you itch and then you touch your face and then there it is. And I mean, in the summer months, I know that people are getting it, I guess, more often, and it's probably even more annoying because it's so warm outside. Yeah, that's a problem. But what about the winter? Do you get it in the winter? Well, you can, and we see it year-round. We see it more this time of year because people are anxious to get out and work in the yard and run the weed eater and that type of thing. The plant goes dormant in the winter, but the resin or the sap in the plant does not. So if you get one of those nice days in the winter and you go out and you're going to pull the vines off the fence or do a little work around in the yard, you can absolutely contract poison ivy in the wintertime. So you always have to be aware of what this looks like. You got to be on the lookout all the time. And do you just have to touch it, or I mean, are there other ways of getting it? Well, the resin from the plant has to come in contact with your skin. Okay. Usually what happens is we're out there weed eating, mowing, pulling weeds, and we break the plant. The resin comes out, it gets in contact with our skin. But the tools that you're using, if the resin gets on those tools and then you go back later and touch the tools and then you touch your skin, then you've transferred the resin to your skin. So there are indirect ways too, and the resin can get on the fur of pets too. So the cats and dogs are out running around in the woods, they disrupt the plant, they get the resin on their fur, they come back in and rub up against your leg and deposit that resin on your skin, then you can get it that way too. And now you were saying the tips to basically get around this is to just avoid it and to know what it looks like, right? Well, that's the biggest one. There's a couple other options. There's some commercially available preparations that you can put on your skin before you go out if you expect that you're going to be exposed. And some studies show about a 2/3 reduction in the incidence of developing the allergic reaction. But the biggest thing, if you even think that you have gotten the plant resin on your skin, grab the hose and a bar of soap and just wash it off. Just keep washing it off. And time is of the essence. And I guess, and if your mom picking up kids, cover it up perhaps so you don't spread it to the kids? Well, you can't, once you wash the oil off your skin, you can't spread it. You can't spread it. It's a commonly misunderstood thing about poison ivy. The fluid that comes out of the blisters is just part of the inflammatory response. It's tissue fluid. It doesn't have anything to do with the poison ivy itself.
Well, thank you so much for joining us.
Sure,
really
nice
good
to be back with you. Thank you.
Just head to our website if you want more. Click on the Moms Everyday tab after you head to WSAZ.com. More Moms Every Day after the break. Stick around.